Okay, I'll call the meeting to order for April 20th.
This conference will now be recorded.
Look at the minutes from the previous meeting. Any corrections or comments?
Hang on, Pam. I got to read that paragraph before you start your meeting.
I'm sorry.
Okay.
Go right ahead.
This is the Town of Harwich Board of Health meeting, Tuesday, April 21st, 2020. Remote meeting pursuant to Governor Baker's March 12th, 2020 order superseding certain provisions of the open meeting law. General Law, Chapter 30A and Section 20, the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Harwich Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. The meeting is yours, Pam.
Okay, I now open the meeting. We will review the minutes from the previous meeting. Any corrections or comments? Okay, Sharon, do I hear?
Yes, I just have a small, what I think is a correction on what is my page 3. Under the discussion of the environmental impact report from Eastwood.
Okay.
Right, in that second paragraph, the big one, Chairwoman Powell, you get down to the mid, there's a section there that says the applicant now understands that the sewer line installation in this area may not be completed for at least 2 years and I think that you want now being forced to look at. It says, and not being forced to look at. Does it mean now?
And are not.
Yeah.
It's right in the middle of that, little below the middle of that paragraph.
Being forced to look at.
Says, and are not being forced to look at alternatives. It didn't seem to make sense to me. Maybe it was me. I thought it should have been, and are now being forced to look at alternatives instead of not.
Oh, and not being, I got you. Yes. Jen, can you make a correction? You see that? Okay.
That's
I can change that.
Okay. So we will change that to say now instead of not.
Okay, that was my only
No,
observation.
good pickup. Okay. Anything else? Okay. Sharon, are you in agreement with last month's?
Yes, I am. I make a move, we accept meetings, the minutes from my last meeting. However we want to say that.
Okay. And Ron, are you in agreement with the minutes?
Yes.
And Matt, are you in agreement with the minutes?
Yes.
So I hear a motion from Sharon to accept the minutes. And
I don't know if you,
Matt, you want to second it?
I'll second it.
Okay. Second is Ron, and so the minutes have passed. I am in agreement with the minutes, so it's unanimous. Thank you. Okay, Megan.
I don't know if you're talking, Megan, but we can't hear.
I did it to myself. I didn't unmute myself. Continue review of draft Town of Harwich nutrient and pesticide control bylaw / education. All discussion will be continued until the May 18th, 2020 Board of Health meeting. I need a motion to approve to continue to the May 18th meeting and then a vote to to do that.
I'll make a motion for that.
Okay. And a second?
I'll second it.
That was Sharon, and all in agreement?
Sharon is yes.
Aye.
Yeah.
And that,
Ron,
okay.
yes.
Unanimous to have the discussion continued till the next.
Board meeting.
Did you hear me with that?
Yes.
Because I think I turned myself off too. It's unanimous that we continue it until the May meeting.
Correct.
Okay.
Okay, so the next item on the agenda is a COVID-19 discussion. I will start by giving you some updates on some numbers. The state reported out numbers for today, Tuesday, April 21st, with 1,556 new cases for a total of 41,199. In Barnstable County, we have 672 positive cases. And in Harwich, we are remaining at 29 cases. So that is really good news. We haven't had a new case in 10 days. So we are doing
How many deaths in Harwich have there been?
One death. There was a newspaper, correct. A newspaper article that was misleading, saying Harwich has had a second death. However, that person worked in Harwich and did not live in Harwich.
Okay.
So we still have one death.
One death.
One death, and there are 1,961 deaths in the state total. And what is alarming is that there were 152 new deaths over the last 24 hours. So Governor Baker has, at his press conferences every day, reiterates that we are in the surge, and that surge is reflected in cases, but also by hospitalizations and deaths. The cases are known to climb because we're doing more testing, but it's the deaths and the hospitalizations that really tax that healthcare facility. And what we're really trying to slow the spread for and flatten the curve is so we don't overtax the healthcare facility.
What's the age group of the people that died, Megan? Do you know?
Well, good news, I don't want to call it good news, but 97.5% of all the deaths that have occurred are in people that have a pre-existing condition, and most of them are in the 80 to 90-year-old age group. The average death age is 81. So we have at least one case. Oh, go ahead.
How many nursing homes do we have in Harwich?
We have one nursing home and one assisted living facility, and both of those do not have any cases.
Okay, that's great.
Yes, yep. I've been in contact with Rosewood Manor a few times a week just to check in on them, make sure they have everything they need. Wingate is a big company, so they have all the help that they need, but they know how to reach us if they need anything.
Great.
How many new cases in Barnstable in the last 48 hours? Is that rising or?
It is. Yeah. I'm trying to look back as to yesterday. I think we were just below 600 yesterday, but I'm going to look at the archive right now. It's nice to be able to have this on the computer right away. As I'm looking for this, Governor Baker did announce today that schools will be closed until the rest of the year. And that goes along with childcare facilities that aren't for essential employees. So there's a list of childcare facilities that are approved to stay open, and there's one in Harwich, but there's plenty in other places. If you could put your phone on mute, please, and when we'll call you when we're ready.
Okay.
Thank you. We're just in our work session right now. I'm still looking for that other information. Archive cases, here we are. So on the 19th, there were 632 cases in Barnstable County. A week ago, they only went up by one in one day, and then each day from there, there was a 10 to 20 per day increase. So it is still rising in Barnstable County, and Pam, you probably could speak to that firsthand working at the hospital. See more cases every day.
Yes, but thankfully, a lot of the people who are tested, the results now come back within 24 hours, and they're not all of them, but they're testing negative. There's a lot more negative testing results than positive. Because they're testing a lot more.
They are, yeah. They are seeing that a lot of people that are being tested are asymptomatic and testing positive. So that's really good epidemiological information to be able to identify the positive cases that are asymptomatic, so they don't go out and spread the disease without knowing it. Something I wanted, go ahead. Sorry.
I'm sorry, just clarification. So, so the last 48 to 72 hours in Barnstable, there's about 20 new cases a day.
That's right. 632 on the 19th. And I can pull the 20th. Knowing that it was a holiday weekend. Barnstable County had 664 yesterday, so not as many in that 24 hours.
32 new cases.
Mm-hmm. 32 new cases from the 19th to the 20th, and then only 8 new cases from the 20th to 24th.
That's a good thing.
Mm-hmm. Mm-hmm.
Just have a question there. Did that include the ones from the nursing home the 60?
I don't know.
In Brewster.
Brewster is in Brewster, yeah. I didn't want to.
Yeah.
I didn't know.
I'm not sure if those numbers included it yet or not.
It wouldn't seem to be. It only looked like it came up from 64 to 72 in one day, so it doesn't appear that they're there yet.
Right, unless those numbers were in the system, because that article came out Sunday or Monday.
What is today?
Monday, I think. I think it came out Monday.
Monday, so they would have been.
Did that include the staff on that or just the residents?
I only know what the reporters write, so I don't know. I think it was just the residents.
Okay.
Because on the 18th, there was only 590 cases.
Yeah.
So they may have been included on the 19th numbers.
Well, that would be 60. If it's 60 plus 590, that's going to be 650 then, right?
Right.
So that would may not be, doesn't jive.
No. No. Any other questions about cases or where people can find them or how they're reported?
I have a question though, Megan. Is the town going to see if they can start testing people on a regular basis, or they have to be symptomatic?
It's up to the providers. It's not something the town is offering. Everyone who gets tested needs a doctor's prescription to get tested.
Right.
There's plenty of tests, so it's really up to the providers to do that.
Okay.
I'm not aware of any plans to do testing through the health departments. It's not out of the question, but I think that it's being looked at commercially, like CVS is doing it, Walgreens and stuff.
Sure.
Yeah, but still, you need a doctor's order in order to get test.
Oh, I understand that. Sure.
Even the home ones. Now there's a home kit that FDA approved, and that one you need a doctor's prescription to get sent to you.
How accurate are they?
I don't know. If they're approved by the FDA, I'd imagine they have to go through some kind of testing, but I believe it's the same kind of thing, a nasal swab. So the difference being you're doing it yourself instead of a medical professional. So I guess it all depends on how efficient you are at swabbing yourself.
How deep you want to go.
Yeah. As far as town-wide updates, I've been working with Joe Powers, the interim town administrator, to do some different policy type openings and closures and government operation changes so we can protect our staff as well as the public. And over the last couple of weeks, we've made some changes to town hall and the community center and the library in anticipation of this surge week. We closed all buildings and requested that staff work remotely even more than they were the week prior. Prior to last week, we were allowing staff to enter the buildings and work half days here and there to get some work to take home. And with the surge, we wanted to do whatever we could to reduce the impact on new cases and potential first responder needs, and not only with COVID related, but keeping more people off the road so we can let the first responders focus on COVID calls rather than other emergency type calls, motor vehicle accidents and things like that. Hopefully the surge is coming down and we'll be able to reassess tomorrow and possibly next week start to have more staff in the buildings. Staff's doing a pretty good job at working from home. A lot of staff members are able to bring work home and work remotely, but there are some staff members that don't have as much access to their work at home. So it'd be really great to be able to get those people back into town hall to get some more work done. The transfer station, we made some changes there. We had originally closed down the recycle area because it was nearly impossible to socially distance there with the setup that they had. And working with Link, the DPW director, we came up with a plan that single stream recycling. So, people aren't just putting the recyclables on tables for staff to sort through later. So it greatly reduced the risk for both the staff as well as the public. So that's working well. We did have to close down the C&D manure and yard waste for a week as well, mostly to reduce the number of staff we needed because it was a very important week to reduce person-to-person contact as much as we could. And I think we made a really good impact. But those have since been opened up with new traffic patterns to allow for socially distancing and keeping 6 feet from each other. And the DPW is pretty much back up in operation as best they can right now. The library is still closed, and Council on Aging is operating as much remotely as they can. They are still doing meal service for seniors. Meals on Wheels is still operating out of the building, and they're delivering groceries and doing pharmacy shopping for some of the residents that can't get out themselves or aren't comfortable getting out themselves. So those services are still in place. Our town nurse is still working. She has her clients that it's very important to get out to, and she's working remotely as much as she can, but she does need to access her office every now and then. And our social worker and our youth services coordinator is still holding therapy and behavioral health counseling with youth and families, mostly by video conference like we're doing now. And she said at first people were reluctant to use it, but she's got a full caseload and people are happy to have that service. What else do you want to get into? The packet has case number information, and I wanted your opinion on masks and gloves. People have been emailing our office incessantly with questions about why we have not adopted a policy on that. So I'm going to open that up to you, Pam, to call on the members so they can have a discussion about gloves and masks, particularly masks.
Sharon, any comment?
Yes, I do have some comments. All right, I'm going to preface this for anybody that's listening so that they don't think it's just my opinion. All right. I'm a clinical microbiologist with a master's degree, and I was a director in a medical hospital lab for greater than 15 years. I have a second, while I was there, I was certified in infection control. And since then, I have a master's in clinical research and administration, working with the pharmaceutical companies on upcoming drugs. So I'm going to put on my hat for infection control and some of my experience of working in the lab. I happen to think that anybody going out right now should be wearing masks. I think one of the biggest issues with COVID-19 is we don't know enough about it to know how it's behaving. With influenza, which is different than coronavirus, and I did have someone ask me about that. So they are two different viruses. With influenza, usually within 24, 48 hours before you have symptoms, you're infected, meaning you can infect other people. COVID seems to be a little bit different. I see they go anywhere from 2 days to maybe 2 to 3 weeks. And I think that is what makes this so pathogenic, is that you can have people out walking around without symptoms and not knowing that they can infect somebody else. So you wearing a mask, even though you feel well, is protecting yourself. All right, well, I shouldn't say that. You're actually, these masks aren't meant to filter viral particles, all right? So by you wearing that mask, that is protecting you, if you're asymptomatic, from spreading the virus to somebody else. The person you may be walking past or talking with wearing the mask is protecting you. So if everybody is wearing masks, I think it makes a lot more sense, considering we really don't know how many people have been infected. We really don't know that. We haven't had enough tests to do prevalence testing. I think the other issue with the testing is we've heard an awful lot about some of the tests that weren't FDA approved and are either having false positives and or false negatives. And although with any test, you get a certain percentage, it seems like to me, it really makes it dangerous to assume anything one way or another that way. So I personally feel that we should have some sort of a regulation stating that people, when you are going outside right now, should be wearing a mask. Whether you feel that you don't feel well or for whatever reason, everybody should be doing that. Gloves probably aren't to me as important as the mask. Because if you wear gloves, you can still contaminate yourself or somebody else. So there, I think the hand washing becomes important, really important. After you come inside, cleaning doorknobs, cleaning your keys, cleaning things that you touch all the time. But to me, knowing what I know about this virus and knowing what I know with infection control, I think masks are necessary. That's my opinion from my background. I am not an expert in this by any stretch of the imagination, but from my background, I would recommend that we have something stating that people going outside should be wearing masks.
Thank you, Sharon. Ron, any comments?
Well, I'm a little bit different. I would, if I live near the beach, and so if I'm walking around the beach or taking a walk down the road and things like this and nobody's around, I don't see the point of having a mask. I think if you're in company with other people, especially people you don't know and things like this, yes, if I'm going in the store, yes, sure, I'm going to have a mask on. But I think the idea, I think even the governor said something about getting some fresh air. I think that's very important. I think by walking around on a nice day like Sunday without a mask on, I thought that was very refreshing. So I think I'd modify that a little bit.
Can I add something to that?
Yes, Sharon, go ahead.
In a sense, I agree with you. If you're out there by yourself, I think one of the things that Kumo brought up in New York was having a mask, at least having a mask with you.
Oh yeah, no question about it,
Yeah,
you know.
Yeah. All right, so if you're out walking and you are totally by yourself, then no, you don't need anything, all right?
No.
But I think you should have one with you. Now, there have been some studies and some really good studies that are showing that, let's say you're walking past somebody on the bike trail or on the
Sure.
in a parking lot.
Yeah.
And they would happen to cough, and you could still be 6 feet apart. What they are finding is that those droplets are hanging in the air a lot longer than they had originally thought. So there is that chance that even just walking past someone, you could possibly, I think the chances are remote, but I think they're there. In cases like when you're totally on your own, by yourself, I don't see any reason to have a mask either. But I think you've got to have one with you so that when you do come, when you get close to someone, you have it available.
Matt, any comments?
I agree with Ron. If you're entering a structure, you definitely have to put a mask on because you're going to end up seeing someone there. And outside, you should have one with you just in case you encounter people. But most people aren't trained to use gloves properly, so they're going to misuse gloves improperly, and they're going to be, touching things that are dirty and then getting into their cars with the gloves on. So most of the time, people aren't simply trained to use gloves correctly. So I think masks are the critical point, and washing your hands frequently as often as possible.
Should we
Megan,
continue this? It's after 7. Should we
Hello?
go to new business or anything, or continue this?
We can do new business and come back to this if you'd like.
Yeah. Why don't we
Okay. Okay, so we'll pause this discussion and bring it back up after we finish our new business.
Okay.
Okay, so Parish, you are on the line. So we have a new business. Hold on, let me get to the agenda again. We are slow. Okay, request for extension of Board of Health condition, request from 21 Plus Smoke Shop at 1421 Orleans Road to extend the deadline of their approved tobacco application until April 30th, 2020.
That's not essential business, right?
It
that
is
an
not
essential
essential
business?
business. No.
Do I hear a motion to,
I have no problem with that, yeah.
do I hear a second?
I'll second
Like a
that.
second.
Okay, so
Okay, that's fine.
Ron, you've first.
Can
Matt
I,
can second it, that's fine.
Sharon, do you have a question?
yes, I do. So are we saying that we agree with the April 30th, or we want to make it go longer? I'm not sure what we're agreeing to here. He's asked,
Extend it for 2 months.
what I'm reading here, it says that it extends it until April 30th.
But they're, I have to find it. Megan, aren't they requesting 2 months?
I'm trying to get to it in the,
But mine is saying it says
Application.
request from 21 Plus Smoke Shop
yeah.
on Orleans Road to extend the deadline of their approved tobacco application until April 30th.
So there, in your packet is the request from Mr. Patel, and his request says we are still in the process to get a lease done because it's such a big company. It's hard for us to get quick responses. We have a contractor lined up and just waiting to get approval from the landlord. I would appreciate approval for a 2-month extension.
Sorry. All right. Okay. Oh, I would go ahead.
Are you in agreement, Sharon, or do you have a question?
No, I'm in agreement.
Okay. And I'm in agreement, so we have a first and second, and so it's passed unanimously?
Yes.
Yes,
Can I ask a question just so I make sure I have the motion correct? So you're giving him 2 months from today's date?
Is that what it is, Megan?
Well, his extension went until April 30th, I believe, and this would go until
June 30th.
June 30th.
Okay.
Does that clear it up for you, Jen? So this extension would go until June 30th.
Okay. Patel, are you okay with this?
To unmute your phone.
Yeah, I really appreciate you guys doing this in this situation. Hope everybody's doing well with the family. And I really appreciate, 2 months gonna be okay. At this point, we don't even know how far we're gonna go with this and how long this crisis is gonna last. But we appreciate 2-month extension. We'll take that.
Okay, you stay well. Okay.
Thank you. Be safe. Thank you.
While we are on making motions and voting, why don't we do the permits? And then we can go back
Okay.
and finish with the COVID discussion. The only new permit we have is for a licensed utility installer for Peter McIntyre and Sons. The other applications are renewals for 2020, so existing businesses that are asking for renewals.
What's the new one? I'm sorry.
Peter McIntyre and Sons is a licensed utility installer, so that's for sewer extensions, sewer main.
Okay,
sewer,
that's a new one? Okay,
Yes.
okay.
Do a motion to pass the permits? Okay, let me go back. Ron, Sharon, are you in agreement with this?
Yes,
Sharon, are you in agreement with passing the permits?
Yes.
Okay, and Ron, you are, and Matt, are you in agreement with passing?
Yes.
Can I hear a motion?
I make a
Second.
motion to accept the permits.
Okay, a second?
A second.
Okay, so it was Sharon first and Matt seconded it, and we're all in favor. I'm in favor, so it's passed unanimously.
correct.
Okay, Megan.
So I wanted to bring to your attention two memos that I did email to you so you could have them. One is a memo from the Provincetown Board of Health regarding
Sandwich.
Right. So one is from Provincetown, and it is that one is in the opinion that masks are not going to be promoted because social distancing should ensure proper infection control, because masks at this very moment are not exactly in we don't have a plethora of masks to give to every person in the community. So even though we don't need to have them as actual masks, you can use any kind of face covering. Provincetown is of the opinion that that social distancing is a more effective way of controlling respiratory illnesses rather than face masks. And then the other...
Any cases in Provincetown? Any cases in Provincetown right now?
Last I knew they had 19, but I'm sure that number has gone up since last week. So yes, they do have cases in Provincetown. The other memo is from the Sandwich Health Department, and they have made a declaration of public health emergency order, which says that all employees of essential businesses shall wear a face covering over their mouth and nose when interacting with the public and within 6 feet of a coworker. So that is for employees. And then they also say things about reusable shopping bags are prohibited, and that an employer has to adhere with the guidance of the 40% occupancy of the building and such. So they do not have an order for the general public to wear face coverings, but they do have one for employees of essential businesses. So that's something to think about.
Yeah.
And there was a letter.
There was a letter that we were going to read into, and I'm going to find it now. Let's see. Jen, do you have that handy?
I'm sorry, did you ask me something?
I was asking Jen if she had that.
I believe I do. Hang on one second.
Okay. So I didn't save it to my desktop, so
Yeah, I can.
So we sent it to, and I got it. I found it.
Okay. All right. I just pulled it up too.
Okay. So this is a letter emailed to the Board of Health. It's from Joe Nystrom. He is on the Barnstable School Committee, and he has he sent this to all boards of health on the Cape. Greetings, I'm calling on you to consider an emergency directive or ordinance in town to require the wearing of masks or face coverings for customers in all Barnstable County shops and stores. Please consider my argument before writing me off as an alarmist. Only Cape Codders can save Cape Codders during this crisis. We have a fragile population and a fragile health system, and now we have visitors from all over retreating to their vacation homes. It is your job to use science, data, and evidence to make calls at the local level, especially in the unprecedented situation like this. Our essential workers have a right to work in a safe environment, and our shoppers have a right to shop in a safe environment. We all share the same health system. Our best interests are intertwined. Similar to smoking laws, this directive will make our shops safer to work and to shop in Over 80% of transmissions are thought to stem from pre-symptomatic or asymptomatic cases. People don't know when they are contagious, and we're about to enter allergy season, exacerbating the crisis. I'm asking you to make a call on this as soon as possible, as the horror stories from the front lines of this battle fill our news feeds. This will not be a hard sell. It will require courage on your part, along with cooperation and vigilance from our police department. Other towns in the state will follow suit. Please be leaders on this. I have included links, et cetera, et cetera. And the links are from wired.com, YouTube, sciencemag.org. The CDC and the governor suggest it. Proper donning of masks and washing hands procedures could easily be communicated on town websites and through links provided by local media. They can emphasize the importance of using non-medical face coverings to prevent supply shortages and provide links to do-it-yourself masks, websites, and videos. These communications can also stress that washing hands, not touching your face, and social distancing are measures that protect you from others, but covering your face is a measure that protects others from you. Up to 50% of active cases may be asymptomatic at any time. Godspeed, Joe Nystrom.
So Megan, we had received another email as well that I had forwarded from a Robert Gaston, Harwich resident.
All right. Mm-hmm.
I have that one up. I'm happy to read it if you want.
Yeah.
Okay, so we had received an email from Robert Gaston, Harwich resident. I have been told that rather than recommending that people wear masks in grocery stores, towns have to mandate their use in supermarkets. Several cities and towns in Massachusetts currently have such mandates in place. As I walk around shopping, I'm surprised how many people there are that ignore the recommendation to wear a mask. With summer coming, I have a great concern that without such a mandate in place, what could happen with people from hot zone areas coming here and shopping in our community without masks. If a grocery store employee gets infected from exposure, what type of reporting regulations are there that require a business to report the incident to health officials? There also is a question of how to handle assuring sanitizing rental properties between turnovers. What type of regulation could be made to assure renters' safety? I know owners want to maximize income, but they also have a responsibility to the general public, not to contribute to what could very likely be another hotspot of this virus. Better to prepare for an incident rather than having to come up with solutions in the midst of the chaos that summer brings. Thank you for your consideration.
Comments?
I have a comment. I happen to agree, as I said before, with everybody wearing a mask. I think only to have employees wearing a mask, they're protecting us walking into their establishment. And I think they have a right to be protected as well. So I think anybody going into an establishment should also be wearing a mask. I happen to agree with people wearing the masks.
So, Megan, what is our jurisdiction as far as what he was commenting on rental places?
Right now, rental properties, Airbnbs, motels, they're all ordered closed by the governor. So right now, that's a non-issue. And I'm sure when that becomes an issue, we'll have guidance on it from the state.
Okay.
So right now, that's kind of.
Don't worry about that. Okay. What are your feelings, Megan, about masks in stores?
The CDC recommends that all people out in public wear a face covering now. I think that people want it. I think the majority of people want there to be a mandate on it, but I don't know who's going to enforce that. We already are getting phone calls about people not wearing masks now, even though it's not a regulation or an ordinance. So I can only imagine the influx of complaints that we'll get, not only we'll get, but the police department will get, because really they're the ones that are going to be able to enforce it. With one staff member right now, 1.5 staff members, I'm not going to be able to enforce any of this. So it would be more of a feel-good local ordinance, which I don't think is a bad thing if we put out a strong recommendation from the Board of Health. But a regulation, I think if you're going to do a regulation, you've got to be able to enforce it. And I just don't see how we can do that.
I think we should have. I agree with Megan. I think we have to have something that is strongly stated that in order to protect yourself and protect your neighbors, and we should have some kind of local suggestion, not regulation, that all people cover themselves and stuff like that. So I don't. When you start, like you say, regulation becomes a problem, and then you have the police department, and find who's, like you say, who's gonna regulate it.
I kind of agree with that, but maybe I don't know if we can get any kind of posters from the Board of Health strongly suggesting, to put on the entrances of stores, to just say that as the Board of Health, we strongly suggest.
Yeah.
Sure.
Stores could do that. Stores could say that, in order, like Shaw's, like they say, if you're going to come into Shaw's, you should have a mask on. Something like that. But maybe those are the only regulators I can see.
Matt, any comment?
It's like Megan was saying, a very hard issue to regulate, and just letting people know that we strongly support it and we would like to see them out there with the masks is good enough. I mean, if you're getting calls already and we don't even have anything in place, I mean, I can just imagine how many more calls we're going to get if we actually have an ordinance for that. So.
Oh, yeah. People nobody would come to Harwich.
Yeah.
Well, no, I'm sorry.
Well, that's easy to say if you're not dependent on the tourist trade.
Right.
My office is dependent on a lot of people who,
Yeah.
who come in the summertime and things like this, and a lot of stores, a lot of businesses are dependent on tourists. And so, we're again, and 60% of the houses in Harwich are owned by off-Cape people.
Just have a question there. All right, so you wear a mask. If somebody comes in to your establishment not wearing a mask and you get infected, how are you?
Well,
I'm sorry, Sharon, could you repeat that? I didn't hear that.
I said, if he's wearing a mask and he's protecting people coming into the establishment from himself, all right?
Yeah.
And you got people coming in there without a mask and you get infected, how are you going to feel?
It's one of those situations, you can't tell everybody, I don't think you can regulate it. I think people have to use some common sense. And if we have something out there that says, okay, we strongly suggest it for the protection of yourself, for your health and your neighbors and your friends and everybody else.
I guess my feeling is common sense hasn't been that common. And I think I said common sense isn't that common. And I
understand that, but
that's some sort
I understand that.
I think you're going to have people, when they look at the numbers, and right now we're not testing. We don't know how many people are really infected here. All right? We only know when they have symptoms and they get tested. So we can have a lot of people walking around here that are infected. And I think that opens up a big case. And I guess I'm for a regulation that says for right now, and we can loosen it later, I think right now it should be when you're out in public, you wear a mask.
No, I can't agree with that.
Okay, but Sharon, how would we regulate it?
Well, you're not going to be able to regulate it 100%, all right? But
I don't see how we can at all. We're going to call the police on someone that doesn't have one?
Why not? And they order a citation. It's being done all over the place. They're all doing it.
I don't think they're getting citations for that. I think they're getting citations for being congregating together.
They give them warnings and they give them citations. And
I think we'd be the only town on the Cape that was doing that then.
Well, I don't know about that. I'm not going to make that because I don't know for sure. I don't know that any of us here really know what the other towns are doing, how strict they're being, and whether or not they're enforcing it.
Well, there aren't any towns on Cape Cod that require people to wear masks out in public.
All right, but are they in Massachusetts?
That I don't know.
Because I thought they were requiring them to wear masks in Massachusetts. I'm not going to say Cape Cod, but Massachusetts. I thought
it would have to be town by town. So I don't know.
But that's my feeling.
Well, I think it's a great idea, but I don't know how we could enforce it if it was a regulation. And maybe closer to summer, we would have to do something like that. But I think right now, just more signs, encouraging people.
I think we put a lot of signs. We put signs up. Just like we do for everything else, put signs up all around the place. That's all. That's the only thing I can think of that, doesn't, let's say, we need 1,000 more policemen.
Any other comments from anybody?
We can do a reverse 911 call urging the residents to wear a face covering when they're out in public.
That's an excellent idea.
Yeah, that's a good idea.
That's an excellent idea. Okay. Just like when you warn them about, something else like storm is coming, things like this. If you have a call every once in a while, once a week or so, everybody realizes how important it is,
Okay, I mean, we don't have to do a vote or anything. This is just a discussion, right, Megan?
Right. If you wanted to make a regulation, would have to have it posted as a different type of meeting. So this is good information. And I think without needing a vote, we can go forward with more education on masks in public with a reverse 911 call, maybe another video or PSA on channel 18 and
website, stuff like that, you know. Yeah. Maybe a few signs around town, things like that, you know. That's, I mean, the more visible, the more people see it, the more they're going to pay attention.
Mm-hmm. And, you know, we could put, it saves lives, you know, something.
Well, no matter how you word it, that's what we're trying to do.
Yeah.
Okay. Until we can get, you know, everybody tested, obviously.
Okay. Anything else? You want, you have a director's month report?
My director's report is all COVID. So that is the only thing I've been doing. So I didn't write a special report. We've been working on all COVID related stuff. We did get funding from the state to cover the majority of our contact tracing and case tracing through the VNA. The VNA contract is for $4,000 for fiscal year 20 for regular communicable disease case follow-up. We had about $1,300 of that $4,000 left at the beginning of March. And our March bill just for COVID only expenses was about $1,300. Is that right? Was it 24? It was $2,400, I believe.
$2,400.
$2,400.
I thought the VNA was not accepting any COVID positive patients.
They do our tracing. They're not taking care of the patients. They do our MAVEN follow-up. You're probably familiar with MAVEN. So any infectious disease, I get notified and then it goes to the VNA for follow-up of the case. So they don't physically go anywhere. They just do the tracing and the follow-ups. So the state gave local boards of health money as part of a relief package, and Harwich is receiving about $12,000, which should cover our VNA bill, our COVID infectious disease tracing bill. So that's very good news.
You have that in hand right now?
I have a question. We've been told any positive COVID patient, we make a referral through the visiting nurses to make a referral to the Department of Public Health, who then follows the patient. So this isn't, the VNA continues?
No.
Follow, not see, but follow?
Nope. So the doctor may refer them to the VNA additionally, but when a positive test result goes into the infectious disease database, it starts an investigation. And some towns have a public health nurse. We don't, so we contract with VNA to do that.
Okay, got it. Sorry, didn't understand.
Okay. Yeah. Yeah, I mean, we can talk about anything COVID related that you have on your minds and have questions about what I do, what is happening. So fire away if you have questions.
Okay, what are the selectmen? What's the stance of the selectmen on this? Okay, and I think we should run the masks by them too and things like that. I mean, what is their stance so far on the selectmen? I haven't heard anything.
They're taking guidance from me. So I'm asking for your guidance, and then I'll refer it to them. They have been very supportive of my opinion.
Okay. Well, I think if we made, like I say, we made some signs up and we had that reverse call like you were talking about, I think that would be a great start. Okay, at least, you know, we see signs all around town, and I'm not sure where you get the signs of who makes them, or they'd be like a poster, I imagine.
Yeah, CDC has some pretty good posters.
Yeah, something like that. Yeah. Yeah.
Yeah, and we can put local Board of Health information on it, so it's
Exactly.
Any other discussion?
Not right now.
Sharon?
Nope. Nothing further.
Is that it for the agenda?
that's it. I think that was it for the agenda.
Okay, sounds good.
Okay.
Need a motion to adjourn.
Yeah. Hear a motion to adjourn.
I make a motion to adjourn the meeting.
I'll
Second,
second it.
Matt, you in agreement?
Yes.
And I'm in agreement.
I'm in agreement.
We'll adjourn.
All right.
Thanks, guys.
Okay.
Thank you.
Be safe.
Thank you, guys.
Bye.
All right, bye.